Good morning, everyone.
Good morning.
Good morning. Good morning, everyone. Thank you for joining the Community Connect Live with Support Fibromyalgia or International Support Fibromyalgia and Looms for Lupus. I am Estela Mata, one of the co-founders of Looms for Lupus. And Looms for Lupus is a nonprofit organization that provides support to those living with lupus and overlapping conditions such as fibromyalgia and mental health. We are here for you. We support the community and advocate for you.
And I'm Juana Mata. I'm another co-founder of Looms for Lupus, and we're here to support and provide resources to the community.
And I'm Melissa Tolwer, the ED for the Support Fibromyalgia Network. We focus on fibromyalgia patient and medical education, research, and advocacy. Welcome to our Community Connect Live. We're going to get started by sharing our screen and going through some of the highlights we've had for the week. It has been a busy week ahead, so I'm excited to see some of these highlights for you today on September 18th, 2020. Okay, so let's participation. Here we go. We're celebrating National Hispanic Heritage Month, and I know Juana and Estela are very involved with this. So what do you have on your plate?
So first of all, National Hispanic Heritage Month is celebrated from September 15th to October 15th. One of the highlights that we have is basically we're trying to focus on highlighting a couple of things that impact the Hispanic community. And for us, speaking about lupus and also about, clinical trials and research and participation in research has been huge. I'll give one update in regards to all of us research program, and my sister Juana will give an update on the how lupus affects the Hispanic community and what we are doing to advocate for that. So in regards to the All of Us Research Program, if you are not aware of, it is a program that is funded by the NIH, one of the largest funding research that has been given. And we are actually, both my sister and I are patient advocates on part of the virtual advocacy team, and we get to share our stories on why we participate on we choose to participate. And one of the reasons we choose to participate is because 17% of the US population is Hispanic Latino and only 1% participate in clinical trials. So that's like a huge gap. So one of the things that we like to do is just talk about participation in clinical trials and also just, more efforts in regards to, all the conditions that, affect our communities. So I was able to share yet another, on another webinar, the story of why I participate in this program. And if you guys are want to know more in regards to this program, it is, all you have to do is go to allofusresearch.com and or the NIH, and you can sign up there. It's free, and you can opt out at any time.
Yes, absolutely. I also participate in the All of Us research with virtual, and I'm also as a national advocate or
National ambassador.
Right, national ambassador, and I participate with the All of Us research at the USC LA County in Los Angeles, California. And like Estela said, we share our stories and we talk about why it's important to participate in clinical trials and why it's important for us to, as being Hispanic, why it would benefit not only the person that's participating, but the community, the Hispanic community as a whole. So, okay, so I'll start sharing about lupus. Lupus is an autoimmune condition. Basically, your body attacks itself. It is very difficult to get diagnosed with lupus because it mimics so many other conditions, other illnesses. Lupus mainly and disproportionately affects women of color, African American, Hispanic, and Native American groups, and the symptoms tend to be more severe. Just wanted to share just within my family, my sister and I have lupus, and my mom with actually the systemic lupus, which is the lupus that attacks all the organs. And my mom was diagnosed with drug-induced lupus. So that's why we need more studies on how lupus affects the Hispanic community. We need more participation in clinical trials. Like Estela mentioned earlier, Hispanics make up 17% of the US population, and only, sadly, 1% participate in clinical trials. It is so important that we participate in clinical trial treatments, because it affects everyone differently. Not one case of lupus is alike. There was a study in Manhattan, in lupus among Hispanics and Asian women, and it showed that female ethnic population have significantly greater organ complications such as kidney disease, and prevalence rate for Hispanic was 84.6% per 100,000. We need to monitor symptoms. Well, if you need to monitor your symptoms, we do have a list that you can get from loomsforlupus.org. So I encourage everyone to look in our page and, check out what we have, the resources and the information about the symptoms about lupus. And
For Syndio Health, for the Syndio Health, thank you, sister, for giving us that update. Lupus mimics so many other conditions, so it's very important for us in the Hispanic community to, to track our symptoms and go to the doctor if we have any of the symptoms that are listed on our page. But Syndio Health beta test, and Melissa, are you participating in this? In the beta
Well,
test?
I signed up, so
Okay.
and we shared it with Rob, so I heard from him. So we definitely registered. I guess there's different groups, so you'll be placed in different groups after you submit the survey information.
Yeah, so the Syndio Health beta test is basically a new community for, if you guys are familiar with like patients like me and maybe, other organizations have a community platform. It basically is a platform that you can register to and get information and share information from other people living with your chronic condition. In my case, I would, I have enlisted for the beta test. And one of the things that you might think, well, why should I register for something like this? Or, we already belong to so many community groups on Facebook and, all over the place. And one of the things that I do love when we saw the beta test, when we saw the kind of the information in regards to what Syndio Health is one of the things that I liked was that I'm going to be able to not only share what has helped me, whether it's homeopathic or, maybe, essential oils or just different types of things that have helped me. I can actually post it on there, and then other people can share their stories, and I get to select and kind of pick and choose what I want to see and what I want to read and engage with and who to engage with. So I think it's going to be great. We'll bring you more information. Hopefully we get chosen for the beta testing. We did have to register, and we'll put a link if you are interested in participating. So that's for the Syndio Health beta test update.
And I did add a link already in the description, so you should be able to see that. This time I was ahead of the game for all of us. So there is awesome. A link to Syndio Health's website, and you can apply to be a beta tester.
Yes, and shout out to Rob if you're watching.
Well, and I love with Christine and Rob, so you may have seen Christine post as well. So I guess she has joined as a new advisor. So shout out to Christine, giving her lots of love and light right now.
Yeah.
So we also, I guess for next week, there's an event coming up with one of our organizations, another organizations you hear from a lot, the Invisible Me Warriors with Michelle. We will have more information shortly on the details for registering for that. It is about chronic illness, and we're going to have discussions on mental health, trauma, and just surviving all of the stuff with all that we're going through right now.
Yes, and you remember this month we're raising awareness for pain awareness and also for suicide prevention. So those two topics will be discussed, and you will be getting tips from different people and therapists. So we're pretty excited to be part of that. So, just looking forward to that. So we'll give you more information coming up soon.
The last, I guess one of the other bullet points I had in here was from our side was these food access polls that we're going to be starting to put out. We've had to revise our plan for the Impact Fund. It was supposed to be all in person, and now we're switching to virtual. So we're getting approvals for this, and this is talking about food insecurity and food access for those of you living with fibromyalgia and overlapping autoimmune conditions. So keep a lookout for that on our social media pages, especially Facebook. Was there other items on the list that you wanted to add to participate in or review?
Yes, I think there was something that I kind of added kind of last minute. So this week on, well, not this week, this weekend, which is tomorrow on September 19th, there's going to be a virtual race. So Team Looms for Lupus has registered for the I Give a Care 5K, I Walk, I Roll to raise awareness for pain. And this is through the International Pain Foundation. I'm sorry, International Pain Foundation. I always get the name wrong, but I said it right this time, so I'm proud of myself. So we will be walking. It's basically you walk virtually, and we've registered. And if you guys want to register, you guys can do it from the comfort of your home. And as long as you prove that you completed the 5K, submitted, you will get a medal. So I'm looking forward. This is our first year that we participate. Shout out to Barbie and Ken for organizing this. They've been doing this. They did a walk already earlier this year. I think it was in May. We missed it, but we wanted to make sure that we raised awareness during the month of Pain Awareness Month. You know, in our family, we live with pain. All three of us live with chronic pain. Right now, I'm on high dosage of prednisone, so I have high energy, even though I haven't slept much. So we know how it is to live with pain, and you know, I just want to make sure that I raise awareness for all the different conditions that cause pain.
That's fantastic. We'll be sure to add some links to your team so people can support you and support the great organization, the International Pain Foundation, and they do a lot of great work. So we're looking forward to that. I know they have stuff coming up in November. So I think in our other chats, we'll be sure to share content from them. I'm looking forward to the symposium that they have too. So,
yes.
So I just wanted to also thank the Healthcare Leadership Council for organizing the meeting with Congresswoman Judy Chu on Thursday, and at Patient Advocates. I had the opportunity to attend along with Liz Helms from California Chronic Care Coalition, and we discussed barriers to quality of healthcare. So I just wanted to share that with everyone.
Oh, fantastic. We'll be sure to add those links for everyone as well so they can learn more about the organization and the work that you're doing. And definitely applauding Representative Judy Chu. I know she's been busy with our area. She's done some virtual meetings for all of us who are affected by the Bobcat fire. So I know she's been on these virtual chats and she's been really busy. So I look forward to hearing more about the discussion you had this past week. We've been busy in San Gabriel Valley.
Yes,
yes, busy with the fires, all the allergies, the smoke, and you know, all the conferences that we've been attending this week.
I know we participated in a lot, so I didn't get to add some of this to the slide, and I know Estela and Juana will update with some of the other meetings they had, but I guess I'll just start out with the PCORI and the NIH. So this was a great conference to actually attend, the PCORI virtual annual meetings. We shared out some of the content on our Twitter accounts, so please go check out some of the conversation there. Just some of the things is like the punk rock organization of patient research. And I don't know if there'll be a recording set up for this event, but we'll be sure to send it out if there are. Some of the panels that I sort of were a part of was building an effective multi-stakeholder research team, which was great on how to do that. I know I have a lot of interest with research, building research capacity to address disparities. I think overall, they're really trying to engage more patients in the process and having patients as stakeholders in the research process. And I know I know Juana and Estela are heavily involved with that, and they speak out all the time on different conferences. So it was good to have their perspective. We definitely need to have you back on just to specifically talk about that over again. And then part of the NIH workshop on myofascial pain, this is definitely going to have a recording, and we'll share it out. They always upload all these webinars, and I was really intrigued by it because of the overlap and confusion with fibromyalgia and just with pain. So this was very science heavy for those of you that are really interested in some of the
And
science.
Melissa loved it.
Well, they were showing screens. I was taking screenshots of some of the slides of the muscles and the fascia and how they're using ultrasound technology and all of that to really see what's going on. So they talked about the state of science of myofascial pain syndrome, clinical presentation, pathophysiological hypothesis and challenges, a lot of science information, and then structural images. So that was very fascinating to get an overview of all of that. And they dove deep into what we're looking for. So it was nice to see this presentation. And I've seen some other people comment that it was good that they're talking about this because they're really addressing some of the differentials that you would look at when it comes to myofascial pain and some of the overlapping confusion with some of the conditions that we manage. So we'll be sure to share those links, but I'm going to let Juana and Estela take over for what their meetings were this week.
Okay. And, in regards to the myofascial pain, Melissa, one of the things that I saw that it was so interesting is not only did we have that workshop and they were discussing about, all the similarities, and a lot of people like me, I lived with pain forever and I wasn't diagnosed with fibromyalgia until 2 years ago. So a lot of my pain was like up in my upper shoulders, and I saw there's actually a study, and I believe it was either at the ACR or one of the other, like posts that I saw in regards to a study that was conducted in regards to a myofascial pain and pain with fibromyalgia patients in the upper shoulders, and a lot of it is because of that the fascia. And if the fascia is really, really tight, that's what causes our pain, and it doesn't. It prevents the flow, the blood flow. So that was really, really huge. I'm going to look for that information in that study so I could share it, but they are saying that it might be something that rheumatologists can look at when they're diagnosing people with fibromyalgia. So that is something that we're interested in. But yeah, in regards to the meetings, obviously, like Juana was talking about, we have to thank Liz Helms from the California Chronic Care Coalition, because of her, we were able to attend and be part of the discussion as patient advocates with Congresswoman Judy Chu. There's actually a couple bills that I will be posting, that way you guys can share and maybe discuss with your legislators locally. I think there's about 4 different bills right now that we would like to present to our legislators so they can support us. And I believe the American College of Rheumatology did meet with legislators on September 14th and 15th. And, we were not part of those panels, but I was able to get all those bills together. So I will be hopefully sharing with you, Melissa, too, so we can share with the community. So from home, you can advocate. So you don't have to, travel. Obviously, right now we're not traveling, but you don't have to have experience doing this. All you basically have to do is send an email to your legislator and let them know, can you please support these bills? One of the bills is to support, the rheumatic disease and chronic illness, those people living with those diseases and how COVID-19 has impacted us. We know with those living with lupus, it impacted, the shortage of, the hydroxychloroquine, which was devastating, but it also has affected a lot of communities that see rheumatologists, especially in rural areas. Melissa, and you know how difficult it is for people to go see a rheumatologist. Not only do they have difficulty already because there's like one rheumatologist for 40,000 people, right? So we already have a shortage. So one bill supports that. And then another bill supports, just the impact that it has taken on COVID-19 in our communities with like telehealth and making sure that the providers actually get paid full as if it was an office visit, because when we come in, we have a list and a plethora of conditions and overlapping conditions that the doctors have to treat it a little bit longer than a regular patient. So there's another bill for that. And there's a total of 4. So we'll share that information with you guys. So I just wanted to highlight that.
Well, maybe we can do a video overview of all these bills, because I also forgot to include, we have another one from Crystal Kent that put it out. She tagged us in it. Is the DAV introduced the HR 4, I can't talk today, I apologize, 4554 legislative bill, which would require the Secretary of the Department of Veterans Affairs to establish and implement a comprehensive anti-harassment and anti-sexual assault policy for the department. So I know I filled that out and sent it over to my rep.
Yes. Yeah, exactly. She did tag us, and Crystal does so much advocacy as well. And, she makes it so easy for all of us to just want to continue on this bandwagon. We all have a voice, and our voice does matter. So just remember that, you can go ahead and reach out to your legislators. The other thing that I was able to attend this week, like I said, it was pretty busy, was it's called the Tercer Congreso Panamericano de Pacientes con Enfermedades Reumáticas. So I'll translate it in English, right? So it's basically, it's called a Pan American, patients with, it's like a conference for patients with rheumatic diseases. And one of the things that I loved about this is that they actually have patients leading a lot of these sessions along with a doctor or rheumatologist or specialist. And it highlights the patient being the expert in their bodies. And, so they talked about what is lupus, what is, gout, what is rheumatoid arthritis, and all other rheumatic diseases. But the highlight again was continuing to live your life with these rheumatic diseases. And again, highlighting the patients was huge. The only other conference that I attended that highlighted some patients were the Datapalooza last year. I have not seen anything like this. And it was all in Spanish. It was transmitted virtually through their webpage. It was also transmitted live on Facebook, and they had an app. So people from that had just had surgeries in hospitals were watching this live. I was watching this live. People from everywhere were able to watch this live, and you can still go back and watch all these videos. And it was pretty amazing. Again, I love the fact that everyone is now understanding that we, the patients, have a voice. We know what we feel, and we have to continue to feel empowered and use our voice for advocacy, not just for ourselves, but for others. So that was really huge. So I'll send you the link so we can post them up, Melissa. So I know I talked a lot about this.
No, that's perfect. We definitely need to be sharing those links. So we'll get those links added to the description for everyone.
And that's all in Spanish, correct?
It's all in Spanish. It's all in Spanish, but there's a lot of abstracts that were not live that were being posted, and those are in English. So if you, this is the first time you hear about this, really at the American College of Rheumatology conference every year, PANLAR goes there. So a lot of their abstracts and research and everything has to be in English. So that's the language. So you'll see a lot of, information in English, but the specific, webinars that I was attending and the live sessions were in Spanish, and I loved it.
Fantastic. We'll be sure to share all that. Was there any other updates to add for this video, or?
I don't remember now. Can you look really quick on the notes, really?
I skipped back, so I don't see anything extra.
I think that might be it for this week that we attended.
Well, then we're celebrating a special occasion this year with everyone, so we wanted to maybe close out with an open discussion on some of this stuff. Speaking of advocacy, this is Flashback Friday, so last year on this very day, and tomorrow actually is our flashback to our first annual Fibromyalgia Advocacy Day. We couldn't have done it without the help of Juana and Estela and their wonderful family. So we took over Capitol Hill, and we'll be sharing some memories from that. So if you do have pictures, if you attended with us, please share and celebrate. And if you do follow some of the other advocates that attended, please share their photos and let people know about this momentous occasion. We did go back in March for a rushed event, but the September event was great. We had training, and we also did a lot of exceptional meetings with our representatives.
Yes, and Melissa, you know, one of the things, like, that was the first flashback, that memory that came up on my Facebook page this morning. And it just made my day. You know, again, last week we talked about something joyful. This is what brings me joy, to be able to work with you. And, you know, you have been such a huge motivator to just, you know, push our limits. Like, you know, before I would be hesitant. Can we do this? Can we not? And with you, you know, you're full force. You drive me, and I love it, because this is what I like to do. And, you know, you're my fuel. So I love this. But this Flashback Friday is pretty amazing with the memories, you know, having my daughter Isabella, who lives with fibromyalgia and chronic migraines, and having, you know, my sister living with lupus, fibromyalgia, myself with fibromyalgia, and Cassidy, who still has not been diagnosed but lives with chronic pain every day and chronic fatigue. You know, we're just making sure that we support each other, and that we remind everyone that your voice matters, that you are important, and that you can, you know, continue to advocate and continue to support, you know, your community by sharing your story, because it does make a difference.
Definitely makes a difference. And for us who did this last year, did this year, and we will continue to do it, not only for ourselves, but also for our community, for those who are suffering and going through the pains with fibromyalgia and other conditions. So we are, you know, we're blessed to have Melissa, and for us to have done that with her last year, this year, and for years to come. And we do this not for ourselves, but for our community. And like Estela says, this is what gives us joy, and this is what we want to continue to do.
Well, an amazing thing is you both have been advocating at the federal and community level for a while for lupus, and you've been making trips to DC. So I think that's where I got the inspiration from, is like, okay, let's do this for fibromyalgia. So we welcomed everyone here. And I know this is sort of perfect timing in that sense. We've done some videos in the past on advocacy, and we'll continue to do videos on patient advocacy. But we wanted to open up this discussion to others watching too, so kind of just share your top tips on patient advocacy, and we'll definitely have more of these for you, both of you. But is there a top tip that you wanted to share with everyone watching?
I think one of the top tips is for people to know and understand that you do not need to go to Washington or anywhere. You can do advocacy from the comfort of your home. You don't have to go out and travel at all. You can just do it, and we can share information as to how to do it from home. Stella?
Yes, and well, the tip for me is just basically, you know, just, you know, use your voice. You know, a lot of the times, you know, we, you know, especially, you know, with whatever has happened in our past or in our lives, we tend to shut down and not speak out. Speaking out is not a bad thing, you know, if especially if you're helping others. So, you know, just want to encourage everyone to feel empowered. And if you ever need anything, you guys could reach out to us, because we will be assisting you in whatever you need.
Yeah, I mean, this is just encouraging people. And I know we have a share time in this sense. So it's kind of just welcoming all patient advocates on all fronts, you know, taking care of your own healthcare, being your best healthcare advocate. You can be a community advocate, just sharing in your community. And this means specific disease community or local community, and then state and federal level. So I think these are just what we have. These are some of the tips that I put, not a comprehensive list, but we wanted to invite people to just continue to discuss, ask questions. If you want to be more involved with patient advocacy and just advocacy in general and how to do it, please reach out to all of us. So it's just great to be an active participant in your health. You can ask for help, and just stay connected with the community and everyone around you, because we're all here to help and encourage and mentor and get more people involved.
Right. And you do not need to have a condition to participate. You can always participate because your loved one or somebody that you care for has a condition. So you do not need to have a condition to be able to speak up, to, you know, to be the voice for somebody else.
Yes, and we have so many people saying hi. Hi, Leslie. Hi, everyone. You know, I can't see all the messages because I'm not on Facebook, but I want to just, you know, say hi to everyone out there. Thank you for tuning in. You guys can, you know, share these videos. That's also a great way to share your voice, sharing, you know, the videos that you see, sharing the information, because, you know, if you can't, or if you, you know, can't, you know, either use your voice or for whatever reason don't want to, maybe somebody else does. And if you share these videos, they can help another person. And especially, you know, living with chronic conditions, sometimes people are homebound, and if they just get something like this that can inspire them and motivate them, that would be so greatly appreciated. So
Okay, I just want to say hi to Lizzie Janet Lozada Guadalupe from Puerto Rico. She says she has an organization, and es Fundación Caricias para el Alma. And Leslie Moreno also. Hello
I'm glad you took the pronunciation of that. I saw that and I was like, oh no, I'm not even going to try that. People know I am half Spanish, but yeah, I think I'm just all about the science. So
yes. And you know what? One of the things that I was thinking, Melissa, is because we have so many people following and that are Spanish speakers, you know, what I was thinking is maybe after this, we can try and figure out, let us know if you want us to have like the slides in Spanish or part of the presentation in Spanish, like, you know, or I mean, I know we're going to be working on YouTube videos, but all this content is obviously from this week and participation for like this coming up week, etc. So every week we have live reports. So just follow our social media. But if you need anything translated in Spanish, just reach out to us. I don't know how we can do everything in both languages, but we will try and connect with our Latinos and Hispanos out there in our language, in Espanol. So I'll just, you know, I'll leave it at that. Hopefully we can do this. Maybe sister, you know, we can do this because I know we have to wrap up now because we're already going.
And everyone, ladies and gentlemen, you have heard it live. So this is stuff that I've been talking to Juana and Estela about, of just creating more content. So yes, they've committed live. So we're going to hold them to this right here.
Yes, we are going to do this. You know, right now, you know, it's been a little busy, but we have to make time for these things. These things are important, and our community is important to us. So, hi, Blanca. So I just also, I think Melissa, you're not going to join us right after this presentation on the Instagram Live. But for those of you that do have Instagram, please tune in at Instagram Live. I think it just got some work.
Oh, well, I mean, Michael Mondragon,
Yes.
he does have a Spanish background too. So, I mean, his Spanish is much better than mine. So, yeah, he can help.
Nos comprometemos, Mike, right? I said, you know, we are going to be committing to this. So there's a lot of work ahead. You know, thank goodness for our families. You know, they keep up, they try to keep up with us. We're like moving at 1,000 miles a minute. So, you know, shout out to Mike because I know that he's always so supportive.
Well, and
So
he
we
went with us in September to take all those pictures. It was
Yes.
difficult without him in March. We tried, but
all right, we tried, but you couldn't be replaced at all.
no, he couldn't. I mean, he got that amazing shot of us at the Capitol Hill, like with us so cheering and all these other pictures, the group shot. So
Yeah, exactly. And we got to take a picture of you and him because I know
Oh,
that he doesn't really come out on pictures. So we wanted to make sure to highlight him, you know, so that was pretty amazing. So shout out. Thank you, Michael.
which is a whole nother topic of involving caregivers in advocacy. So if you are a caregiver out there and looking to get more and being an advocate for your loved one, please connect with us. And, you know, if there's enough interest too, we can host some events catered to other caregivers getting involved.
Exactly. Well, thank you everyone for joining.
Yeah,
ahead,
thank
Melissa.
you to Juana and Estela for being here with this Community Connect Live. I just took a moment to have this last slide. Take a moment if I enjoy this weekend. So definitely share with all of us on what brings you joy. And if you're having trouble finding some joy, please reach out and post a comment as well. But we're definitely here for you.
Definitely. Have a great weekend.
Right. Everyone have a great weekend. It might not be easy sometimes with everything that's going on to see positive things, but you know, there's something that that could possibly you know, make you feel better. Remember too, self-care is important, so take care of yourself.
And be sure out there, if you follow all of us on Instagram, so join Estela and Juana right after this on their Instagram channel. They will be going live. So post your comments and join them in the discussion. I look forward to watching it a little later today. Thank you, ladies.
Thank you. Bye, everyone.
Bye.
See you next Friday.